Let's get started this morning. Let's talk about COVID, and let's talk about what Bari Weiss, former New York Times reporter who now has a podcast and has made the rounds, been on Joe Rogan before and so forth. Anyway, Bari Weiss was on the Bill Maher program over the weekend, and the mainstream media is really freaking out about this. CNN particularly, The View did a whole segment about this, and she basically said, I'm done. I'm done with COVID. It's over. It's over and out. Now, we can't play the HBO clip because they will demonetize us. They always flag our stuff as copyright, so we can't play you the HBO clip. But I'll just sort of summarize what Bari Weiss had to say. She said, I'm done with this question. I'm done with COVID. She said, I went so hard on COVID. She said, I remember she even had her Pringles cans, she says, that I bought at the grocery store and I'd wipe them down. She was like, I would strip off my clothes and thought that I had COVID in them and I got rid of it all. And she said, but now you're told you get the vaccine, you get back to normal life. And we haven't gotten back to any kind of normal life. She talks about the city of Flint, Michigan, which I didn't know this statistic. 80%, she says, of the minority students there just announced an indefinite virtual schooling. In the past 2 years, she said, we've seen among young girls a 51% increase in self-harm. She said people are hurting themselves, killing themselves. She said they're anxious, they're depressed, they're lonely. She said, I'm done with this sort of pandemic of bureaucracy. I'm done.
To which the mainstream media says, you are a selfish jerk. A lot of people still can't be done. There are still thousands of people who are dying every day. And there are still many people with pre-existing conditions who are terrified to get COVID. They point out to her that since the United States is around 30% vaccination rate, she can't be done because their argument is that because so many people refuse to get vaccinated, the pandemic spreads, ignoring the science that the vaccinated and the unvaccinated both spread COVID. Right. It's interesting because she has been saying this. It's only become a meme because she was on the Bill Maher show. But in fact, her show, I was just listening to it yesterday, called her podcast is called Honestly. And she said exactly this in the January 14th episode called Bringing Sanity to the Omicron Chaos, where she has 3 doctors come on who specifically are talking about, is the COVID theater that we do right now actually doing anything to prevent the spread? And are the preventative measures that we're doing right now, do they mean anything? And specifically, they talk about the efficacy of the vaccine, where these doctors, epidemiologists, are saying, yes, we are disappointed that the vaccines did not stop the spread. We thought it would. Now doctors need to say it doesn't, right? We are not at all sure whether or not masks are stopping the spread. The science on that is not in. So she's not saying this because she's just got COVID fatigue, although we all do. She's saying this because she's not sure if the way we are changing our lives is working. But the mainstream media does not want to hear anybody say anything like that.
Yeah, we have a clip from CNN kind of devoted a whole big segment to this about how we can't believe that Bari Weiss would actually say these things in public, in good nature, right? So here's what they brought on a panel of doctors to talk about this. All right, so I apologize. I don't know why we can't hear audio on that. Well,
so what he was saying, I'll just paraphrase, is
10,000 people are dead, right?
For the thousands of people who died that she was whining about the inconvenience of living with the pandemic, and that it wasn't just an inconvenience for 10,000 people. It was very real because they lost a loved one. I don't think that she was complaining about wiping down her Pringles can. What she was saying is that I am not clear that these things still help, and the science is not clear either. And so anyone who wants to call her selfish, I ask them to listen to the hour-long podcast with the doctors who are saying, we're not sure that what we're doing is helping anyway, but what we do know is that the pandemic harms some people. And I guess that, look, what is the Kabbalah saying? You don't see things as they are, you see things as you are. So if you are someone with a pre-existing condition or who's lost someone who was otherwise healthy but lost them to COVID, then you see this very differently than, say, somebody who knows that someone in their family is getting beaten up by their spouse because of lockdowns, right? You're gonna see it differently. And I think what's awful is that we cannot talk about these trade-offs, right? We know that losing even 1 year of education lowers the lifespan of a child. This is true, okay? But we don't talk about how do we prioritize the lives of these children over the lives of people with comorbidities. We have to.
I mean, the argument, so we have a discussion about this. If you've got, as the CDC is saying this morning, if you four comorbidities, right? The people that are in the hospital, of those 10,000 people that died, the data is in on that. And the new data out this morning showing that those people were largely unvaccinated, almost all of them unvaccinated. So at what point then do we say, you know what? We're not going to close down schools. We're not going to close down schools and alter the course of our children's lives because someone has 4 comorbidities, or someone is morbidly obese and has other issues, and they're 75 years old, and we need to focus on helping those people. I mean, at the end of the day, I heard someone say, so they're going to get it eventually, right? They're going to get the flu. They're going to get something that's going to take them out. Sadly,
I think people who live with terminal illnesses really go out of their way not to get those things, but that those things still exist in the world, right? Pneumonia, flu.
Well, and as Dr. Fauci just said, the highly contagious Omicron variant will find just about everybody. Everybody is going to get this, with vaccines or not. So again, what then are we protecting against if we close everything down? And it's going to happen whether you're wearing masks, whether or not. I mean, we're just in this new era now where this is so contagious. And there's even a spot of this new variant of Omicron saying it could even be more contagious than Omicron itself.
Right. So what she specifically says in this podcast is that the problem is that so much information about COVID has been politicized. And so it continues to reach into our lives in ways that don't necessarily make sense, right? Checking children for vaccines to go into a public place, there may not be science behind that, right? But saying so makes you seem like a crazy anti-vaxxer. When that, for instance, the head of the CDC, what's her name? Kaminsky. I'm sorry. When she's Walensky. The CDC was very pro keeping kids in school, but it did seem like the White House shut that down because why, right? Who knows? We cannot remove politics from our pandemic response, but we should. And it's not. And so the response to her saying this further puts politics into the problem. So we're making it worse by disallowing her from saying those things.
Right. And I mean, the point that The View was making and chastising her, and the point that CNN was making and chastising her, is that she's just a spoiled, she's only looking out for herself at this point. And that, I think that's reductive, as you like to say, because even as this doctor pointed out, he's talking about these 10,000 people that died. The data shows they were largely, almost all of them, unvaccinated, or they had 4 or more comorbidities, or they were elderly, right, in that same area. So as we can say this in polite company, right? 85, and his data was wrong, by the way, but 85% of Americans have had at least one vaccine. 2, not so much, right? The second jab goes down, but for one jab is at 85% in the United States. So 15% of Americans have said, I don't care what you do, I am not getting a vaccine. And those are the people that, according to the data, are dying the most, right? They're dying the most and they're hospitalized the most.
Yes, unvaccinated, unexposed.
And so those people have said, I'll take it. I'll take it. Right? So then, given that, should we be then shutting everything else down? They've already made their decision. You're not going to, we can do our best to try to convince those additional 15% to do this because it'll keep them from dying, perhaps.
Right.
But if they don't want to, then, hey, that's it. Right? What, you're going to shut down schools as a result of it?
And so I was really interested in reading the responses to her directly on Twitter from first responders saying, that's so nice that you're done with it because we can't be done with it, right? People with comorbidities such as cancer who, not to no fault of their own, are having to avoid this because it will exacerbate their existing medical health. All kinds of reasons, right? But I don't think that she's saying, like, I'm done with it because I feel like that. You have to listen to the science, to what she's actually saying.
Yeah.
Go ahead.
No, it's an interesting discussion. I mean, I think that the mainstream media's response to this is pretty fascinating. And I think they would love nothing more than maybe to do what Japan is doing right now, which is a new round of lockdowns for a month that they just started this week. 70% of the country under lockdown again to try to tamp down, the cases we're seeing in parts of Europe where the hospitalizations are up, but they're mild. And so
but there's a refusal to like laying these things out on a teeter-totter, right? So, okay, young girls are hurting themselves more. Let's weigh that to like, who will we lose to COVID, right? More women are
harming themselves.
Victims of domestic abuse since the pandemic. Okay, let's also put that on a scale. You shorten children's longevity of life by denying them education. Let's put that on the scale. The story we did 2 weeks ago about how toddlers raised during the pandemic have a failure to thrive. Let's put that on a scale. And let's see what we as a society want to talk about and what we want to accept, right? We know we have a higher than acceptable death rate to COVID right now because we have an acceptable death rate to the flu. We've decided what that is. We have not decided what the acceptable death rate is to COVID. We just know this is not it. But we have to put these other buckets on the scale, and saying like, oh, you're being selfish by being over this is a refusal to weigh these other consequences.
Yeah, I think that's a great way to put it. I mean, I think, but we're not willing to do that because it's it becomes political and it becomes woke. You can't possibly say that someone who chooses this over that or a child's life is. I mean, why do we, women and children first on a sinking ship, right? We've made a choice that women and children, that's who we save first. Right, we made that choice.
Yes,
like
good
that's
point.
In polite company, in polite society, women and children first. Unless you're some elite on the Titanic and you manage to squirrel off and sneak in there, but like that's what it is, right? The men stay back, the women go. We want to further society in that way. So we should be having these same discussions around this. Should we shut down schools? Should we lock these people down so this entire generation are set back a number of years in development? In education, math scores are way down. These kids are, really, really suffering. So because someone has 4 comorbidities and they're 75 years old, what are we supposed to do? I just don't get the thought process of locking down a school because we don't know what vaccinated or unvaccinated can still transmit the virus regardless. It doesn't matter.
Yes.
So what are we doing I don't know. Anyway, I'd love to hear your thoughts on this. Drop us a comment below. But I love the mainstream media's response to this because they thrive off this idea of having this pandemic, keeping everyone home watching cable news.
I suppose. Yeah. In Spain recently, the prime minister said we'd like to move into an endemic phase and his government shut that down. They were like, you can shut up. We're not doing anything of the sort.
Right.
So
we love surveillance. We love being able to, watch you.
Look, there are scientists who have actual data about whether we should do these things, but we don't listen to them. And it's infuriating at this point because it's saying that at all makes you some kind of political whatever I'm doing with my hands.
Yeah, I know.
Yeah.